I'm really pleased to be here today on behalf of SAMHSA, the federal agency whose mission is to reduce the impact of substance abuse and mental illness on America's communities. And I bring greetings today from Pam Hyde, the SAMHSA administrator, who wishes that she could have been here herself. Greetings from her and from the rest of the folks at SAMHSA. I'm the regional administrator for this region located in Kansas City with responsibilities for Kansas, Missouri, Iowa, and Nebraska. But today's a great day to talk about where we've come and where we're going. And I thought, particularly because you're spending some time today reflecting back on some of the progress that's happened in the state of Nebraska, I thought it might be good to reflect back as a whole on some of the progresses that we've seen as we look at the history of behavioral health. Then to spend some time on what are some of the many opportunities and challenges that are going on today. What are some of the many activities, some of the key emerging issues, some of the areas that SAMHSA has as a focus today, and then to think about the future. There's always lots and lots of challenges, but with every challenge comes an opportunity. And I hope today, as we reflect back, as we focus a bit on the activity that's happening today, and as we think about the future, that we can seize those opportunities and move forward together to advance behavioral health and where behavioral health fits within the health and public health of the nation. When we look back, and I know you'll be talking in just a little while about 1083, which was a key point in terms of behavioral health reform in Nebraska. When we look back, it's not very long ago that we were still talking about, involuntary and coercive treatment. And so as you kind of look at this arrow chart, I kind of started with the point where coercive treatment began to be rejected. And then we see other gains as we see the early beginnings of a consumer movement, the early introductions of community support systems, and then the beginning downsizing and movement from institutionalization to community-based care. And I remember being in the state of Kansas, working in Kansas government, when Kansas passed its version of mental health reform. And the resulting downsizing that happened, the supports and services that were developed within the communities, and that was a great cause for celebration, and we've come a long way. But even since then, we've seen some other gains here in Nebraska and across the nation. The beginning of the drive for full social inclusion, more focus on consumer-driven and person-centered care, and really the advent of what we call shared decision-making, where people are making decisions about their own lives. More recently, the rise of recovery and recovery support systems, and then something that our administrator likes to talk about a lot. We've made a lot of strides within recent years with there being more of an understanding and acceptance of behavioral health as a fundamental part of health and as a fundamental part of public health. And really addressing behavioral health as a public health issue. We've got some ways to go on that, and I'll talk a bit more about that as we go. But I think overall, with everything that has happened, we have a lot to celebrate. And the overall goal, of course, for all of this is health and wellness and self-determined and self-directed lives. So increasing recognition of behavioral health as public health, that's been a huge achievement. But yet we do know that we still have a lot of challenges. And with those challenges come opportunities. We know that behavioral health impacts most Americans. We know that it often exists with other health conditions, with cardiovascular disease, with diabetes. Yet it's still sometimes not seen as that health issue that I just talked about. We also know that it can increase the risk for other diseases, And we know that even with all the progress, that there are still lots and lots of disparities in terms of behavioral health outcomes. Disparities around race, around gender, around poverty, just to name a few. And then we also continue to know that some of the effects of some of our behavioral health challenges get played out across the rest of our social service systems, whether we're talking about the child welfare system, criminal justice, corrections and jails, or homelessness. We know that we have a high number of behavioral health related deaths and premature deaths. Persons with a diagnosis of serious and persistent mental illness still die on average 25 years earlier than other Americans, and that's a travesty, and that can't stand. So as we think about, where we've come from and some of the real ways that we've had some real achievements and improvements, we need to consider those challenges that remain. And as I talked just a moment ago about individuals dying prematurely, about there being disparities in access to care, I think it still is very important that we recognize the fact that there's still difficulty in accessing care, and there are huge disparities in access to care for behavioral health compared to other chronic health conditions. And if you look at the chart, you'll see for the 81 million Americans who have heart disease, 75% of those receive screenings on a regular basis. For those with high blood pressure or hypertension, 75 million Americans, 70% of those are receiving treatment. In diabetes, almost 85% of the 25 plus million Americans are receiving treatment. Yet for persons with any mental illness, as we sit here today, still less than 40% are receiving treatment. And that data is even worse when we think about substance use disorders, where only about 11.2% are receiving treatment. So although we've made some progress and have some gains, we clearly have some challenges and opportunities that remain and persist. So as we think about the present and where we are today, I want to talk to you a bit about some ways that we're focusing on some of these issues and some of the activities that are happening within SAMHSA, the rest of federal government, and across communities across this nation. Just to scan the environment, just kind of a bird's eye view, what are some of those things that are standing out there as relevant to our conversation today about behavioral health and where we are today? Obviously we have a changing healthcare landscape. We have Americans enrolling in healthcare in different ways. We have the Affordable Care Act. We have different payment mechanisms. We also have emerging science. Each day, we learn more about how the brain works. There's some particular emphasis on brain science. This presidential administration has focused some significant resources on a brain initiative. So we continue to have emerging science that changes very, very rapidly. We also have an increased focus on healthcare integration, and I'll talk a bit more about that. But again, more understanding of the connection between physical health and behavioral health. We have the final rule for parity, where finally individuals with mental illness or a substance use disorder can access healthcare coverage in the same quantities and in the same manner as for other healthcare conditions. We also have an increase in recognition related to our criminal justice system. We have a call from the Attorney General for more treatment rather than incarceration for substance use. And then overall, we have a greater call to place the nation's attention on behavioral health issues through the President's call for a national dialogue on mental health, through some of the many community conversations that have taken place across the nation in talking about mental health, including substance use, and how that impacts America's communities. So we have lots and lots of things happening within the environment and so much progress. I just wanted to focus more specifically on 3 of those areas that I mentioned in terms of some of the progress we've made. You know, the parity in care. You know, we know that 62 million Americans will benefit from mental health parity. From insurers needing to recognize mental illness and substance use in the same manner as other physical health conditions, from behavioral health being included as essential health benefits within the new marketplace for healthcare. We also know that we've made a lot of progress in terms of integration, physical health and behavioral health integration. You know, many states have developed health homes to address chronic health conditions, including mental health. We have a number of initiatives underway throughout the federal government, not just with SAMHSA, but with the Center for Medicare and Medicaid Services, with the Health Resources and Services Administration and other federal agencies, where we're supporting through grant dollars and research and study dollars effective ways to blend physical health and behavioral health services, whether that's through co-location, whether that's through more fully integrated care, whether that's through physical health services being provided on site a behavioral health provider, or vice versa. So lots and lots of activities going on in terms of integration. And then in terms of access to care, we know that nationwide more than 8 million individuals have signed up for new health insurance access. We know that we have more children on parents' insurance, and that the uninsured rate has gone down from 18% to 13.4%. So we have lots and lots of progress, particularly as we think about behavioral health as part of healthcare. That's had a lot of implication on how we do our work at SAMHSA, and I just wanted to share with you a little bit about some of the areas where we've had some particular focus based on emerging trends and based on some issues that have arisen. You know, one of those is just really basic. As an agency, we're reaching out more, having individuals like myself across the country, whereas until 2 years ago, all of the SAMHSA staff were in Washington, D.C. So there's now one of us in each region of the country. So we're able to be out, sharing the message of the importance of behavioral health, collaborating with communities and addressing issues, and working closely with states to address behavioral health issues. At SAMHSA, we've also made some strides within the last couple of years in really taking advantage of some of the new technologies. We've got some new apps and social media focus around underage drinking, around recovery support, suicide prevention, and disaster response, just to name a few. And we continue to look at ways to make some sense of the myriad of data that we have, just the mountains of data, and to make those accessible in a way that they really make sense, that consumers, providers, communities, families, states can use that data. One of the things that we put out just a few months ago were called behavioral health barometers, and those are very easy ways to measure the status really of each state on just really a handful of indicators around prevention, treatment, and recovery in both mental health and substance use. So there's a particular behavioral health barometer for Nebraska that you can access from our website. And it gives you that data about Nebraska, those trends, and also how that compares related to the rest of the nation. So we're trying to get more information out there and be more of a resource, and also to recognize that particularly as we think about youth and the importance of reaching youth, that it's really important that we're able to adapt to the new technologies that exist out there. You know, we have a number of federal initiatives, and we're working more and more at SAMHSA with other parts of the Department of Health and Human Services, with the Department of Education, with the National Institutes of Health, with the Department of Justice. More and more activities across the different federal agencies. And just to give an example of a few of those, there is a new website that was put up just about a year ago called mentalhealth.gov. That gives you some really, really basic information about mental health, gives resources about where to get help in states and communities, and it's a very good tool. We also have some new federal initiatives around preventing underage drinking called the Talk They Hear You initiative, which is really focused on parents of teens. We're working closely with the Department of Education on some new bullying initiatives. StopBullying.gov can give you access to that. And we're working across federal agencies, including those I mentioned, and the Department of Veterans Affairs on implementation of the National Strategy for Suicide Prevention, and really addressing that issue and the growing challenge among several populations, including our veterans. And one other area where we've placed a lot of emphasis recently has been on prescription drug abuse, and then most recently on opioid overdose, where we're seeing really, really disturbing trends nationwide. So we've really stepped forward with some leadership to put out some toolkits that communities can use. We host a weekly call, which is really kind of a surveillance call with federal agencies and communities across the nation in terms of trends people are seeing in terms of, again, just the damaging increase in opioid overdoses. You know, I say all this in some ways just to talk about the fact that we've realized as a department that we have to work much more closely across government and with other partners. So we've also developed a number of new public and private partnerships, and some resources have arisen from that as well. Probably the most well-known is the Creating Community Solutions, and this comes out of the President's call for a national dialogue on mental health. You know, not too long after the Newtown shootings, the President issued a plan that was really about addressing mental health issues across the nation. And Creating Community Solutions is a public-private partnership, which is really about communities coming together, doing education around behavioral health, and coming up with community-based solutions. And there have been 6 or 7 large national dialogues across the country. The largest one in this region was in Kansas City. But then there's been hundreds and hundreds, if not thousands, of smaller dialogues that organizations within communities have hosted, whether those are school districts, Big Brothers, Big Sisters, Girl Scouts, Boy Scouts, the United Way, to really bring individual citizens together to talk about how to address issues around behavioral health, particularly related to our youth. And coming out of that as well, we developed what we've called a Mayor's Resource Guide on behavioral health issues. And that really is a good guide really for any kind of public official or community official that just, again, gives some basic information and data, some information on how to talk about that, and some tools to address community challenges. So again, more partnerships across federal agencies and more partnerships with the private sector and nonprofit organizations to really bring the conversation and dialogue about behavioral health into the forefront. You know, coming out of that, we were also very pleased in the latest budget that was passed to see some new funding put into SAMHSA to implement some of those initiatives that came out of what's called the Now is the Time agenda, which was the president's proposal, after Newtown, that now is the time to talk about mental health, now is the time to address behavioral health issues. So we have about $115 million in new funding, and I mention that specifically today because our requests for proposals for that funding are on the street right now with some deadlines in June. But there's funding. These are really mainly targeted for partnerships between the education system and behavioral health systems to improve mental health awareness, increase referrals to behavioral health services and support systems within the education systems, some funding for mental health first aid, some specific funding around transition age youth called the Healthy Transitions Program, and then some new funding for workforce activities, some of which is really focused on the expansion and enhancement of the peer workforce, which I'll also mention a little bit more later. And I might give a shout out to Nebraska as well in terms of mental health first aid. I understand that your unicameral has invested some new resources in mental health first aid, and so I applaud you for that. That's a really, really evidence-based, proven program just for helping individuals to understand mental health in the same way that folks understand through first aid courses or CPR courses, things about physical health. So we've talked about where we've come from, some of the many achievements and gains we've seen over the year. I've shared just a glimmer of some of the current activities that we have going on at SAMHSA. So I really wanted to spend kind of the remainder of my time focusing more on what are some of those opportunities as we go forward. The person in that little circle over there, I don't know if you can see that, but they have their hand on their head, and then there's about 6 paths towards the future. And I think sometimes it feels like that. Which path should we go down? How do we move towards the future? And so I just want to speak about a few of those things today and what we're thinking from a federal agency perspective and what that might mean at the state and community level. Again, stepping back, we have a changing environment. We have a changing healthcare landscape with more focus on prevention and wellness. As we said earlier, more recognition that behavioral health is essential to health. Lots more focus on quality. Now, what's the quality of the care and services that are being provided rather than the quantity? More inclusive. Lots and lots of roles changing everywhere in terms of payer roles, in terms of provider roles, and a lot of implications for the workforce. And we'll spend a little bit more time later talking about the workforce. From a SAMHSA perspective, one of the things our administrator likes to talk about is the fact that, and you'll see this on a slide that's coming up, that we can't be our grandmother SAMHSA anymore, that we have to be more nimble. And as we think about the grants that SAMHSA has, some of the research to practice work that we do, that we have to get a lot more nimble. And this slide kind of talks about things moving from kind of an innovation stage where there's really just experimentation to that being translated, disseminated, implemented more fully, and then wide-scale adoption. So part of our focus as a department is how do we move more quickly from that innovation stage to that wide-scale adoption, and what does that look like? And I'm not going to talk about all the different things under each dot, but that talks a bit about some of our activities, whether it's our grants, whether it's some of the technical assistance that we provide to communities, to states, to tribes. Whether that's about some of the social media, as I discussed earlier, some of the workforce development work we do, or the different ways that our funding is used. But you'll hear us talking, quite a bit about, being more nimble, and you'll see some changes in the ways that some of our grants are structured so that they're focused much more directly on being able to move more quickly from the idea stage to wide-scale adoption of things that we know are proven and effective and evidence-based. So the SAMHSA of the future, from 2011 to 2014, we had a strategic plan called Leading Change. And the 8 initiatives are on the left side of this chart. Prevention being the first initiative, areas of focus on trauma and justice, military families, recovery support, implementation of health reform, health information technology, data, and public awareness and support. Within the next month or so, we'll be issuing SAMHSA Leading Change 2.0 for comment. And I hope we can get some comments from folks here in Nebraska. But we'll be looking at 6 initiatives moving forward. Prevention, both in substance use and in mental health, in terms of substance abuse prevention, mental health promotion, will continue to be the top priority from a SAMHSA perspective. The second will be around healthcare and health systems integration. So although we spent a lot of focus over the last few years on provider readiness and enrollment issues around health reform, the issue around the role of behavioral health in the healthcare system is much bigger and broader. And so our focus is really going to be more broad around healthcare systems as a whole and what health integration means in terms of behavioral health and primary care and public health. We'll continue to have a focus on trauma and justice, trauma-informed care, some focuses related to the child welfare system. We'll continue to have a focus on recovery support, health information technology, and then we're adding a new initiative around workforce. And we all know the data. Sitting here in a rural state, I think you can particularly see the data in terms of some of the shortages within the workforce. The percentage of counties that don't have not even just a psychiatrist, but any licensed professional. So we have a workforce initiative that will work closely with the Health Resources and Services Administration in terms of expanding the number of behavioral health professionals, but then we'll have some particular focus around what's the role of the peer workforce, what's the role of the consumer workforce, and what does that look like moving forward? And also, what role does primary care play? In terms of behavioral health. So that's a new focus for us, and I think, frankly, a long overdue focus for SAMHSA, given what we've known for a long time in terms of workforce shortage. As I said earlier, Pam Hyde likes to say, we're not your grandmother SAMHSA. It's really incumbent upon us to play a strong role and use our voice to influence public policy, to continue to focus on data, to continue to do the kind of surveillance about what's happening across the nation, what's happening in communities, what's working that could then lend itself towards wide-scale adoption. It's really incumbent upon us to continue our work on practice improvement and to really target our grant making in a very, very focused way so that there's a real designated purpose for the grant funds. Then we know that the funding that we're granting is really making a difference in the lives of people, that we're learning something from that that can then be adopted more widely. And then, of course, ongoing work on regulations and guidance and public awareness and education. And I wanted to spend just a little bit more focused time in a couple of areas. And the first one of those, you've heard me say the word integration a lot so far today. But as I think about the challenges and opportunities going forward, I think those opportunities for collaboration And just really the necessity for primary care and behavioral health integration can't be overstated. So there's significant opportunities for collaboration between public health and clinical medicine, between behavioral health and primary care, between substance abuse and mental health. And in fact, you know, it's not very long ago that even the substance abuse and mental health fields were pretty apprehensive of each other. And in some cases, that's still the case. And behavioral health and primary care just really being worlds apart. A little joke about this slide. I was just looking at the slide. If you look at the picture, what's on that picture? What are those? Silos. I had a colleague from the East Coast get some of these slides in a PowerPoint that our administrator has done, and she said, I don't know what the point is of the picture on that slide. And I said, well, I think we understand that in Region 7. You know, those are silos. And she's like, oh, silos, okay. So definitely not from a rural or agrarian background by any means. But anyway, you know, behavioral health, since we know that behavioral health is essential to health, you know, there are huge implications in terms of integration. You know, and really the first reason to talk about primary care and behavioral health integration is because it's better for people, because health outcomes are better, because care is more coordinated, services are more integrated. But as we think about those integration implications, it's really going to be important that folks really grapple at an individual, consumer, provider, community, state level on what behavioral health's role can be in the broader context of community health. And what does it mean for mental health and substance use disorders to be understood, managed, and paid for like any other health condition? And what role might primary care have? Do primary care physicians have any kind of a role in behavioral health screening and treatment? You know, I know there's going to be an opportunity during the course of this conference for there to be some training in SBIRT, screening, brief intervention, and referral to treatment. I mean, what's the role of primary care in providing those kinds of screenings? And then what's the specialty care role? What's the role of specialty care, of mental health providers, substance use disorder providers after or in collaboration with primary care? What's that mean for relationships? What's that mean for workforce? You know, I had the chance to visit a provider, a substance use provider in western Kansas not too long ago, and I just thought it was very, very interesting how it illustrated just some of the power of integration. I mean, this substance use provider had a clinical staff person located on site at the federally qualified health center who was there every day, who could do some screenings, who could consult with the physician, and who then began doing some specific work on site at the federally qualified health center. The same provider also had a consumer, really a peer provider who was located on site at the community hospital, located in the emergency room. And as I visited and toured there, gosh, I'll tell you, those emergency room docs and some of the administrative folks from the hospital, they could not say enough things about the positive impact. I mean, just the recognition of when a substance use issue might be in play that hadn't previously been recognized, the consultation that took place, the ability to link persons immediately to treatment, so you didn't sort of see that revolving door continuing. So that's just sort of one example of how one provider you know, has approached the idea of primary care and behavioral health integration. So lots and lots of possibilities in terms of what that could look like with regard to primary care, emergency medicine hospitals, the criminal justice system, federally qualified health centers, local health departments, and just thinking about what some of those partner organizations might be. You know, and I say this a lot when I'm talking to provider organizations, but I think that successful specialty treatment organizations, whether that's in mental health or substance use, will develop partnerships with local primary care physicians, hospitals, and clinics. And I think in many cases, frankly, it's a matter of survival. And as folks are thinking about what that looks like in your particular scenario, I just really urge you to think about what it is you bring to that table. Because you might be at new tables and in new conversations with people who use a little bit different language, but you bring a lot to that table. You bring expertise, you bring knowledge, you bring experience about what works, and it's really, really important voices at those tables. But as I said earlier, the most important reason for integration is it improves care, it addresses the needs of the whole person, makes treatment more accessible, improves health outcomes, you know, like addressing the fact that people die 25 years earlier. Perhaps it addresses issues around tobacco use, you know, and the fact that, you know, a quarter of all cigarettes in this country are used today by persons with serious and persistent mental illness. You know, so perhaps it addresses some of those other health issues. But again, it does all those things about health, and then it also begins to help address some issues around workforce strategy. The last thing I wanted to talk about today, and I alluded to earlier, is we've made a lot of progress as a nation in terms of really a belief that behavioral health is essential to health. We've made a lot of progress in people not thinking as often about behavioral health issues as being social problems or moral issues, but we still have a long ways to go. And as I said earlier, most people know or are taught in some way basic first aid and CPR. Most people know if someone is choking, what that looks like. Most people know where to go or who to call if someone's having a heart attack or if they've had a fall. But most don't know, as we stand here today, the signs of suicide, the signs of addiction or mental illness, and what to do about them and how to help oneself or others. Most people don't know some of that data that I talked about earlier, the relationship of behavioral health to individual or community health. And most people don't know the relationship of early childhood trauma or adverse childhood experiences and what that impact is in adulthood, not just in terms of mental health and substance use disorders, but physical health conditions. So it's really incumbent upon us that all of us take the ownership to have those dialogues, whether those are, you know, one person to one person, whether those are in small groups and communities. But I would challenge all of you here today to think about how you can be part of a conversation about how behavioral health is essential to health, and how that conversation can engage people within your community. Maybe it's at your PTA, maybe it's through a youth group, maybe it's through your church. But, you know, the people in this room understand the things that I've been talking about, but it's incumbent upon all of us to share this conversation and to share these dialogues with others so that we can increase that awareness and understanding so that we have a nation, states, and communities that are really committed to the health of everyone. And by health, I mean behavioral health. By everyone, I mean everyone. So please, today, help us change that conversation so we're really a nation that acts on the knowledge that behavioral health is essential to health, that prevention works, that treatment is effective, and people recover. So seize the opportunity, and again, as I said earlier, remember the strengths and knowledge and experience and awareness that you bring to those tables and those conversations. It's really, really critical voices to expand, outside of the walls of this building into your communities, as you leave this conference. So takeaways. Adapting to our current environment is going to take a lot of teamwork. As I said earlier, SAMHSA'S expanded certainly our partners and the people that we work with on a daily basis. Who might you add to the sectors that you're involved with and connected to and work with? It's critical to involve state and community voices. Don't forget about prevention. Prevention is really, really important. There's not a cookie cutter. One size doesn't fit all. Be proactive and continue to take a long view. As we look back where we started this presentation, we think about sort of the trajectory that we've come down and the progress that we've made. When folks are sitting here again in a few years, there'll be a new trajectory, and some of the things that will be talked about during the course of these 3 days will be some of what's talked about then. So take that long view. But most importantly, recognize that, continuous struggle is what really is going to lead the way to the opportunity for more change for all of us. So I thank you for the chance to be here today. I really look forward to spending some time here in Nebraska and having some time later today to celebrate with you as you look back on behavioral health reform here in Nebraska. Thank you.